My name is Dr. Thomas Infernuso. We'll be discussing TPLO procedure for ACL surgery. TPLO stands for tibia plateau leveling osteotomy. So the knee, anatomically speaking, is made of two bones. You have the upper bone that is called femur, lower bone that is called tibia, and then you have the kneecap that sits right between the two bones. The ACL that is in question is the actual ligament between the two bones. So it goes from the back of the femur to the front of the tibia. And what it does, it works as a brake, like an emergency brake in a car. Once that ACL gets damaged, the two bones are going to be sliding. One bone goes backwards, the other one goes forwards. And that sliding motion is causing the wear and tear on the cartilage. So the TPLO procedure, what it entails, is creating a cut into the bone where the green line is, and then you rotate this portion of bone to allow the incline to be converted into a flat position. So by doing that, the upper bone will not be sliding. And then we use a metal plate that allows us to hold that bone in position. The recovery is usually 2 to 4 months, depending on the breed, depending on the activity, depending on the compliance of clients. If you do a good job, they do very well. If you are not as compliant, which implies you let your dog do too much, of course, the knee will be undergoing strain, stress, inflammation, and that will lead to setbacks. We do stem cell therapy, the platelet-rich plasma, and the nerve block. It's a special product that is called Nocita. It's a product that is releasing the nerve block over 3 days. It's a slow release. It controls the pain beautifully. What we have been doing now is doing a lot of the surgeries as outpatient. They come in the morning, they go home in the afternoon. The surgery takes roughly 30 minutes. Once they go home, the clients will be using a sling to support his back legs, and then a cone that prevents them from leaking at incision. One of the biggest complications is infection. Dogs lay on the ground, they leak an incision, create self-trauma. Because we have a metal plate that can potentially get infected, and then we have a problem because the cone will be staying on for a longer time. So most often what we do is recommend using these cones that will be preventing them from leaking an incision, only for 2 weeks. And the sling is usually used for 2 weeks as well, just to avoid overcompensation and damaging the other knee. The second complication is what we call rejection, rejection of the implant or implant sensitivity. That can happen anytime. It is a foreign body, the body can react to it. The complication rate is very, very low, usually less than 1%. The reason why they do well is because the implants that we use are state-of-the-art lock-in systems, so they're very, very, very biocompatible. Thirdly, the complication that we see is because these patients are too active during the recovery, they overcompensate, and they will end up creating too much strain over the ACL, the other knee, and that leads to a failure. So most often they come in for one knee and end up with a second knee being damaged in regards to the ACL. So we give usually a percentage of 50%. So the overall prognosis is great. A lot of these patients that have torn ACL, they end up being crippled because of the progression of arthritis. And the advantage of correcting the instability allows us to really slowing down that progression of arthritis with the intention to have these patients to go back to full activity. Thank you so much for listening to this tutorial, and I'll be more than happy to have you guys following us on social media.